Good morning and welcome to New Jersey Viewpoint. I'm Ken Rosato. Today we bring you an inspiring new book that will give parents and educators some food for thought, especially on the value of mentoring. We'll also have with us an expert with some safety tips on travel. That's whether you travel abroad or stay domestic. But first, we bring you some new information on alcohol addiction. See, there was a recent study by JAMA Psychiatry that shows that although a third of Americans suffer from some type of alcohol abuse, only about 20% actually seek treatment. Joining us in the studio from Summit Behavioral Health are Dr. William Stanley, the medical director, Jim Kane, their CEO, and Maria Ulmer, who's the executive director of clinical services. Thanks so much for being with us. Doctor, let's start with you. Why is it that so many people don't seek treatment when they drink on a regular basis or maybe drink too heavily on a regular basis?
I think when we start looking at alcohol in the context of society today, it is socially acceptable to some degree. However, at the same time, people aren't aware of their tolerance levels, and sometimes it becomes more of an issue where they know they're becoming encumbered, they know they're becoming impaired, but they don't want to recognize or accept that.
So at what point, there's the big question, at what point is it encumbering on a person? Does it sneak up, or do they just wake up one day and say, all right, today's the day? Or is it just little incremental steps, shades of gray, and do they not realize, and that's the problem?
I think you put it very well. To a large point, it is incremental shades of gray. However, a lot of people just don't want to accept that it is a problem, and they will go ahead and, whatever their tolerance level, continue to drink until one point they get, or until they get to the point where they realize that they're not functional, they're not able to do their normal activities of daily living, they're not able to go to work, they're not able to take care of home, they're not able to take care of their expenses, and then they realize it's a problem. But usually that's further along the line, not early.
Okay, but there are things people can do. and the problem is, it shouldn't be considered a stigma, right? I mean, if you break your arm, you go to the doctor, you get treated for a broken arm. If you, even today, if you're losing your hair, you can get treatment for that. So why is it that people are so afraid to go to their health professional and say, you know what, I think I'm starting to lose control with drinking? Why is there that stigma attached, and why are they so afraid to talk to their health professional about that?
Well, for many years now, again, alcoholism and drug addiction has been classified as a disease. It is classified that way by professionals, but for people, there's a stigma of the alcoholic, there's a stigma of someone who can control their drinking, as opposed to viewing this as a behavioral health or a mental disease. It's viewed as someone who is weak. Also, people sometimes are hesitant to confront their friends. They may drink, maybe not to excess, but quite often there is a fear to confront your friends and not sure what the response will be.
So the issue is you are admitting a certain weakness in yourself, in a sense. That's what people perceive, that if they admit that they are, or first of all, the first step is to admit one is an alcoholic, right?
Yes,
so
exactly.
Now there, now you've stigmatized yourself.
Yes.
Now you are declaring yourself something that you would never want to admit.
Right.
And once you've done that, you're that for life.
Right.
I have now declared myself something dirty, if you will. And I'm sorry for anybody who, so now I've done that, and now I can never undirty myself, so to say.
Yes, right.
So and no one wants to do that, right?
Right.
So if we would just eliminate that whole issue, you have a problem. Again, you broke your arm, go get a cast.
Yes.
And when you start looking at it from that perspective, you can fix the problem.
And again, addiction is no different than some of the other chronic diseases. Hypertension, dealing with diabetes, we view those very much as diseases, and there's no stigma attached to that unless someone isn't monitoring and managing their disease, much the same as you would with alcohol or drug dependency.
All right, Maria, let's talk about some of the warning signs. What should people start looking out for? I mean, it's okay to have, you go to a party once in a while, you have a cocktail with people, you could have a cocktail with somebody, with your friends, and it'd be okay. But what are the signs people should look out for?
As Dr. Stanley was indicating, when there's an impairment in functioning, when we attempt to stop using the substance, but it's difficult to stop. When we begin to use more and more over time, our tolerance builds up, and we need more in order to get that high sensation or the arousal effect from alcohol or other substances. So we begin to use more over time. So when you see some of those tendencies become to pick up up and they add up, family members can start to see around you that there might be a problem.
So we're talking about the difference between a drink, and then you go into abuse, and then we go into dependence. So give us the definitions there.
Well, what we see now with the DSM-5 is that abuse is an indication with two or three symptoms to demonstrate that there's a mild, moderate, or severe indication of alcohol problem. So as we get to dependence, it doesn't indicate that there's an addiction. It means that the body is physiologically requiring that substance. So as you had mentioned, if you have a drink a day, or if there's 2 or 3, we require that over a period of time to be sustained. If we don't, we might experience withdrawal symptoms.
Okay, and let's talk now about, so what if a person just has, all right, look, I get up, I'm fine. I don't need a drink when I get up. I don't need a drink when I'm at work. But between 5 p.m. and 10 p.m., that person is oblivious to anything around them. They'll drink a whole bottle of vodka or something. What is that person at that point, if it's on a daily basis?
Well, again, you're addicted. You have a problem with alcohol that needs to be addressed rapidly. And it will become a chronic and a long-term disease if you don't address it.
And there are a lot. I mean, the alcohol is a toxin. Alcohol is as toxic. We talk about cigarettes being toxic to our lungs. Alcohol is toxic to your liver, to your kidneys, to your brain. It kills millions of brain cells. We think about it glossed over as alcohol is very bad for your body in many ways. It could cause cancers and many. I mean, I don't mean, you're the doctor. you tell me, how bad is it and how many levels?
Yeah, well, long-term use, chronic use, definitely you have what we call Wernicke's encephalopathy, where it's a vitamin depletion. It's a depletion of folic acid and thiamine, which can lead to confusion, forgetfulness, and ultimately to a form of dementia. Liver disease, again, the liver can take many insults, but it'll get to the point where the amount of alcohol that's being consumed will be too much for the liver to rebound, and you can start having liver abnormalities as a result of, ultimately, possibly some degree of liver cirrhosis. Yeah, it's real.
Esophagus?
It's real. Esophageal cancer, high risk.
And these are cancers that are totally preventable. So why abuse ourselves like that, right? So this is really something. So now, what about the study? What do we have, and what are we doing here to help folks, and what could people do to participate?
Well, from my standpoint, one of the areas, again, the study was very good, and the call to action is truly looking at community-based programming tied in with some of the treatment providers. You know, are we providing education? Are we providing early intervention? I think it's fascinating when we look at some of the Center for Disease Control's information that over 180,000 emergency room visits were youth less than 21 years of age who were brought in due to acute either binging or alcohol abuse. So that's huge. And again, it starts at a very young age. The idea is to do as much intervention and education with that population before it becomes long-term and chronic.
That is amazing. And there are medical options. There are pills that could be prescribed that'll help. We were talking about this before. Talk to your medical provider. Talk to your if you're embarrassed to talk to your personal physician, find one that might be anonymous to you. But there are treatment plans. There are clinics. Don't let alcoholism take your life and take you away from your family and your friends. There are treatment plans out there. Thank you so much for being here today.
Thank you.
Really important topic.
Thank you.